Hello friends, today we will talk about a small stone in the kidney. So how is a small stone diagnosed? Mostly your doctor has advised you an ultrasound, maybe for a flank pain or an abdominal pain or for any other reason, and you found that there is a small stone in the kidney. So what is a small stone? So any stone which is less than 5 mm is categorized as small stone. Now the question is, do you need any treatment? The answer is no. All the guidelines, they don't recommend treatment in such small stones. But yes, there are a few exceptions like pilot, or if the stone is causing obstruction, that your doctor will see that if it is causing obstruction, it will need treatment. But if it is not causing any obstruction, it don't need any treatment. So what is going to happen to this stone if it lies in the kidney? So it has been seen in the studies that over next 5 years, there is 50% chance that this stone may pass out itself through the urine. You don't need any treatment for this. But we need to keep a watch on this stone by the follow-up ultrasounds every 6 monthly or yearly, whatever your urologist decides. So this stone may grow big slowly in the size, and then the further treatment can be planned accordingly, depending upon the size and the location. Or there is one more probability that this stone may drop in the ureter and it may cause you pain, vomiting, and the other symptoms. And depending upon the size and the other factor, the treatment of this stone is planned and then this stone is removed. You can check my video on stone in ureter. So what tests you need? Obviously you need follow-up ultrasounds, but if somebody is having recurrent stones, then your urologist will advise you some blood test and the urine test to see whether there is any factor which is leading to the recurrent stones. Now the important question is, do you need to keep any dietary restrictions? So most of the stones are calcium oxalate stones. So the diet which is rich in oxalate, you need to decrease their quantity. It doesn't mean that you need to stop them, you just need to decrease their quantity. And yes, you need to have an adequate amount of fruit, vegetable, and fiber intake. The most important thing is to drink plenty of fluids. You should drink at least 3 to 3.5 liters of the water per day. This is the most important. The salt intake should be less than 5 grams per day, because the salt causes the precipitation of the calcium particle in the kidney. So less salt. The animal protein intake should also be decreased, especially the red meat. We need not to stop the calcium intake. We need to have a moderate amount of the calcium intake because that is also needed for our bones. So if you are not allergic to the milk or you don't have a lactose intolerance, then you should drink at least 2 glasses of the milk daily. This is also one of the important, because it has been seen that obesity is one of the causative factors of the stones. So avoid weight gain. If you are diabetic, please have a very good sugar control. Have a healthy lifestyle, do daily exercises to prevent the metabolic syndrome. Now the most important thing to remember is, if you have a stone, don't ignore the stone, because stone is treatable. And if your doctor has advised follow-up ultrasounds, please get them done to know the status of the stone in your body. Thank you.